Question 1. A patient is prescribed amiodarone. Which lab value is most critical to assess routinely? A. Liver enzymes. B. Creatinine. C. Blood glucose. D. Sodium. Answer: A. Liver enzymes. Question 2. Which assessment is a priority for a patient starting a beta blocker for hypertension? A. Capillary refill. B. Bowel sounds. C. Heart rate. D. Visual acuity. Answer: C. Heart rate. Question 3. A patient taking levetiracetam for seizures reports mood swings. What should the nurse do first? A. Encourage rest. B. Notify the provider. C. Reduce the dose. D. Reassure the patient. Answer: B. Notify the provider. Question 4. A nurse is preparing to administer 4 magnesium sulfate. What is the priority monitoring parameter? A. Lung sounds. B. Pupillary response. C. Deep tendon reflexes. D. Pain scale. Answer: C. Deep tendon reflexes. Question 5. Which action is most appropriate when giving oral nystatin for oral thrush? A. Swallow the medication quickly. B. Rinse mouth before use. C. Eat immediately after taking it. D. Hold in the mouth before swallowing. Answer: D. Hold in the mouth before swallowing. Question 6. A patient is receiving methylorgonavine postpartum. Which assessment would require immediate action? A. Uterine firmness. B. Blood pressure of 160/100 mmHg. C. Lochia rubra. D. Mild cramping. Answer: B. Blood pressure of 160/100 mmHg. Question 7. A patient is prescribed disulfiram for alcohol dependence. Which teaching point is most important? A. You may take it with milk. B. Avoid products containing alcohol. C. Expect increased appetite. D. Take at bedtime. Answer: B. Avoid products containing alcohol. Question 8. Which medication order would be most concerning for a patient with a history of peptic ulcer disease? A. Ibuprofen 400 mg orally. B. Acetaminophen 500 mg orally. C. Famotidine 20 mg orally. D. Omeprazole 40 mg 4. Answer: A. Ibuprofen 400 mg orally. Question 9. Which symptom indicates a serious adverse effect of carbamazepine? A. Mild headache. B. Rash with fever. C. Increased appetite. D. Sleepiness. Answer: B. Rash with fever. Question 10. A nurse is teaching a patient about ferrous sulfate. What should be included to enhance iron absorption? A. Take with calcium. B. Take with orange juice. C. Take at bedtime. D. Take with milk. Answer: B. Take with orange juice. Question 11. Which instruction is appropriate for a patient prescribed an MAOI like phenelzyne? A. Avoid foods rich in tyramine. B. Take with cold medicine if needed. C. Stop if you feel dizzy. D. Take with antacids. Answer: A. Avoid foods rich in tyramine. Question 12. Which patient should the RN see first regarding medication therapy? A. A patient with flushing after niacin. B. A patient with muscle pain on atorvastatin. C. A patient with dry mouth on oxybutynin. D. A patient with insomnia on bupropion. Answer: B. A patient with muscle pain on atorvastatin. Question 13. A nurse is caring for a patient on mannitol. Which finding should be reported immediately? A. Increased urine output. B. Bilateral crackles in lungs. C. Decreased intracranial pressure. D. Decreased serum osmolality. Answer: B. Bilateral crackles in lungs. Question 14. A patient taking tamoxifen reports leg swelling and tenderness. What is the nurse's priority? A. Elevate the leg. B. Assess for deep vein thrombosis. C. Reassure the patient. D. Encourage fluids. Answer: B. Assess for deep vein thrombosis. Question 15. A nurse is caring for a patient receiving filgrastim. What is the expected outcome? A. Decreased platelet count. B. Increased neutrophil count. C. Reduced blood glucose. D. Increased red blood cell count. Answer: B. Increased neutrophil count. Question 16. A patient with schizophrenia is prescribed risperidone. Which side effect should the nurse monitor for? A. Polyuria. B. Hypotension. C. Extrapyramidal symptoms. D. Bradycardia. Answer: C. Extrapyramidal symptoms. Question 17. A patient taking albuterol experiences palpitations. What is the nurse's best action? A. Instruct the patient to skip the next dose. B. Document and continue monitoring. C. Notify the healthcare provider. D. Encourage deep breathing exercises. Answer: C. Notify the healthcare provider. Question 18. Which patient is most at risk for bleeding when prescribed an anticoagulant? A. A patient taking aspirin. B. A patient on furosemide. C. A patient with hypertension. D. A patient with low cholesterol. Answer: A. A patient taking aspirin. Question 19. What is a critical teaching point for a patient starting levodopa-carbidopa? A. It may take weeks for improvement. B. Take with high-protein meals. C. Stop immediately if symptoms resolve. D. Store in the refrigerator. Answer: A. It may take weeks for improvement. Question 20. Which finding in a patient on clozapine requires immediate attention? A. WBC count of 1, 500/mm superscript 3. B. Mild sedation. C. Slight weight gain. D. Constipation. Answer: A. WBC count of 1, 500/mm superscript 3. Question 21. A nurse is administering hydralazine for severe hypertension. Which action is most important? A. Administer over 30 seconds. B. Monitor for bradycardia. C. Check blood pressure frequently. D. Restrict oral fluids. Answer: C. Check blood pressure frequently. Question 22. A patient taking digoxin complains of nausea and blurred vision. What is the priority action? A. Give antiemetic. B. Check digoxin level. C. Offer reassurance. D. Withhold fluids. Answer: B. Check digoxin level. Question 23. A nurse is teaching about warfarin. Which statement indicates a need for further education? A. I will avoid green leafy vegetables. B. I will use a soft toothbrush. C. I will take aspirin for headaches. D. I will go for regular INR checks. Answer: C. I will take aspirin for headaches. Question 24. A patient taking lithium reports increased thirst and frequent urination. What lab should the nurse check? A. Liver enzymes. B. Sodium level. C. Lithium level. D. BUN and creatinine. Answer: C. Lithium level. Question 25. Which finding indicates a therapeutic effect of lactulose in a patient with hepatic encephalopathy? A. 2 soft bowel movements daily. B. Improved mental status. C. Reduced liver enzymes. D. Decreased bilirubin. Answer: B. Improved mental status. Question 26. A nurse is reviewing a new prescription for allopurinol. Which instruction is most important? A. Take on an empty stomach. B. Drink plenty of fluids daily. C. Limit citrus intake. D. expect rapid relief within hours. Answer B. Drink plenty of fluids daily. Question 27. A patient on enoxaparin asks about lab monitoring. What is the correct response? A. Your INR will be checked daily. B. No regular lab monitoring is required. C. We will monitor your APTT closely. D. You'll need a daily platelet transfusion. Answer B. No regular lab monitoring is required. Question 28. A patient receiving 4 vancomycin suddenly develops flushing and hypotension. What should the nurse do? A. Discontinue immediately. B. Increase the infusion rate. C. Slow the infusion rate. D. Administer epinephrine. Answer C. Slow the infusion rate. Question 29. Which assessment is most important before administering metoprolol? A. Respiratory rate. B. Oxygen saturation. C. Apical heart rate. D. Capillary refill. Answer C. Apical heart rate. Question 30. A nurse prepares to administer alteplase to a stroke patient. What condition is a contraindication? A. Onset of symptoms 1 hour ago. B. Blood pressure 180 over 100 mmHg. C. History of migraines. D. Recent head trauma. Answer D. Recent head trauma. Question 31. A patient prescribed methimazole asks when to expect improvement. What is the best response? A. In 1 to 2 days. B. Immediately. C. In 1 to 2 weeks. D. After 6 months. Answer C. In 1 to 2 weeks. Question 32. What is the nurse's priority before administering succinylcholine for rapid sequence intubation? A. Monitor heart rate. B. Prepare for mechanical ventilation. C. Ensure patient has voided. D. Elevate the head of the bed. Answer B. Prepare for mechanical ventilation. Question 33. Which finding in a patient taking dantrolene requires urgent intervention? A. Muscle weakness. B. Jaundice scara. C. Drowsiness. D. Flushing. Answer B. Jaundice scara. Question 34. A nurse is caring for a patient receiving for morphine. Which finding requires immediate attention? A. Respiratory rate of 10 breaths / min B. Itching at the foresight. C. Drowsiness. D. Constipation. Answer A. Respiratory rate of 10 breaths / min. Question 35. A patient is starting bupropion for smoking cessation. What should be reported immediately? A. Insomnia. B. Dry mouth. C. Seizures. D. Weight loss. Answer C. Seizures. Question 36. A nurse is administering insulin aspart. What is the best action? A. Hold of glucose is over 150 milligrams per deciliter. B. Give 30 minutes before meals. C. Administer with the first bite of food. D. Give at bedtime. Answer C. Administer with the first bite of food. Question 37. A patient is prescribed erythropoietin. What must be assessed before administration? A. Hematocrit. B. White blood cell count. C. Potassium level. D. Blood glucose. Answer A. Hematocrit. Question 38. What is the nurse's best action if a patient on methotrexate develops a sore throat and fever? A. Offer throat lozenges. B. Withhold drug and notify provider. C. Administer antipyretic. D. Increase fluid intake. Answer B. Withhold drug and notify provider. Question 39. A patient taking prednisone long-term should be monitored for which complication? A. Hyperkalemia. B. Hypoglycemia. C. Osteoporosis. D. Insomnia. Answer C. Osteoporosis. Question 40. A nurse is administering naloxone to a patient with suspected opioid overdose. What should be expected? A. Respiratory depression. B. Immediate pain relief. C. Sudden return of pain. D. Bradycardia. Answer: C. Sudden return of pain. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.